Hi everybody. I'm going to be talking about the effects of cigarette usage and the health risks that come from smoking cigarettes. Are they really worth it? According to Ansbach, Hamrick, and Rosado, the risk factor most strongly associated with premature death and chronic disease in the United States is cigarette smoking. Cancer, one of the top leading causes of death in the United States today, is attributed to the ingestion of cigarette usage. One major health risk affiliated with tobacco is chronic obstructive pulmonary disease, which is also known as COPD, which is the third leading cause of death in the United States, and a long-term disease associated with chronic bronchitis and emphysema. Cancer not only comes in the forms of the lungs, but it affects the mouth, the larynx, the pharynx, the esophagus, kidneys, cervix, liver, bladder, pancreas, stomach, colon, rectum, and myeloid leukemia, according to American Cancer Society. Cigarettes usage affects many of the body's organs and cripples them. It also affects the reproductive system in women, especially if they bear children, and erectile dysfunction in men. Lastly, uh, heart disease and stroke are cardiovascular diseases caused by smoking. Heart disease and stroke are also the first leading causes of death in the United States. Sorry. Health benefits of smoking cessation. Why should you quit? While quitting cigarette smoking is an incredibly hard process to overcome, I would know because my dad has been trying for multiple years. There are many benefits of smoking cessation. One prominent effect is signifying a decrease in the chances of health risk and premature death. There are also many forms of assistance to aid in smoking cessation, such as community group counseling, um, doctors, therapy, and over-the-counter drugs or prescriptions, for example, nicotine patches. The overall benefit of tobacco usage, the tobacco use sensation, is your body will start to feel the change immediately. Per Centers of Disease Control and Prevention, which is also known as CDC, after 20 minutes of avoiding smoking, your blood pressure decreases as well as your pulse. 12 hours after, carbon monoxide levels in the blood return to normal. 2 weeks to 3 months after quitting, heart attack risks begin to drop and lung function begins to improve. After 1 to 9 months, coughing and shortness of breath decreases. 1 year after quitting, the eight is added to the risk of coronary heart disease, and that's half the year. I'm sorry. Let me start over. 1 year after quitting, the added risk of coronary heart disease is half that of a smoker's. 5 years after quitting, the smoke risk is reduced to that of a non-smoker's 5 to 15 years of quitting. After 10 years of quitting, the lung cancer death rate is about half that of a smoker's. The risk of cancers of the mouth, throat, esophagus, bladder, kidneys, and pancreas decreases. 15 years after quitting, your risk of coronary heart disease is back to that of a non-smoker. Smoking is a habitual. Sorry, let me change this slide. I just wanted to show you guys here what a healthy set of lungs look like versus a smoker's lungs. And a smoke-free work environment. Should smoking be acceptable? And I believe smoking near the workplace should be prohibited. Smoking is a habitual and addictive trait, and it should be prohibited for the health and wellness of all employees to uphold the smoke-free environment. In doing so, the risk of disease is minimized, and individuals who do not smoke are no longer susceptible to secondhand smoke. By eliminating tobacco use within the workforce, it is encouraged that the abundance of people consuming cigarettes will lessen or even eliminate the cigarette practice altogether. A smoke-free environment also reduces the chance of fire and safety hazards. And employees are more likely to be pleased with a company who cares about their well-being and implements overall health and wellness to individuals within the enterprise. The transitional model of behavioral change. Where do you stand in the 6 stages? The transitional model of behavioral change is a self-help program that aids in 6 steps towards smoking cessation. It encompasses the phases individuals must journey through to incorporate a healthier lifestyle change. Per Asbach et al., the 6 stages are pre-contemplation phase, in which individuals have no intention to quit; the contemplation phase, where there's a sense of awareness and people begin to think about the change; in the preparation phase, individuals start to think about the future and plan to take action within the month. The action phase reveals people overtly making changes in behaviors, experiences, and environments. The maintenance stage, individuals retain the accomplishments achieved thus far from the action phase. And lastly, the termination phase, in which the problem behavior is no longer in effect or tempting. If persons are more conscious of the behavior change theory and can classify themselves in a particular phase, they may be more likely to make the permanent transition towards the termination phase. At any given point in the 6 stages, an individual can relapse. I believe the importance of the role model positive lifestyle habits. I'm sorry, that was the title. Can positive reinforcement aid in self-efficacy? And it is essential for individuals to outsource positive role models to enforce constructive lifestyle habits. Having someone to admire who portrays encouraging lifestyle decisions will allow persons to strive for better and become motivated for a healthier way in life. Doing so will unlock the doors to find one's true potential and advance self-improvement. Remaining motivated during the stages of change. How would you remain motivated? And these are just my ideas on how they can remain motivated during these stages. During the pre-contemplation phase, individuals may be too discouraged to seek or outsource professional help, and it usually takes something major like a crisis or emotional trigger to motivate them. In the contemplation phase, individuals may start to think about researching centers or persons that can assist them with their substance and envision a healthier version of themselves. Persons within the preparation phase, persons may have scheduled an appointment to join a counseling session or community group and may be motivated by those around them. Just hearing other people's experiences may help them cope. Action phase would be avoiding the desire to smoke and being around those who still may, and the motivation may be the progress they may feel internally or the body's ability to do things they may have struggled with beforehand. Maintenance stage introduces a lifestyle change or no longer possesses the doubts that they shared in the previous phases. Individuals may be motivated by being able to pass current smokers and feel no regards or desires to go back, or a change in their weight or breathing patterns. Lastly, termination stage. Individuals may have an overall new perspective of life and remain motivated by the new experiences they may have gathered, new friendships, all the possibilities they may not have encountered previously. Smoking cessation aids. Which one do you find more efficient? Oopsie, I don't remember how to go backwards, but there we go. The nicotine replacement program products. Nicotine replacement products are extremely effective at weaning one's body off of the sensation to smoke and the chemicals placed within the body. These over-the-counter drugs can cause a sense of withdrawal and bring forth symptoms such as a craving or urge or to smoke, depression, trouble sleeping, irritability, anxiety, and an increased appetite. These nicotine products come in the forms of patches for the skin, lozenges, and chewing gums, and I just recently learned they come in inhalers as well. There's also a drug prescribed by your doctor, and it's Chantix. You might hear a lot of commercials about it. And Chantix acts as a site in the brain affected by nicotine. The most common side effect of Chantix includes nausea, constipation, gas, vomiting, and trouble sleeping, or vivid, unusual, strange dreams. There are also connections to symptoms such as depression, aggression, and thoughts of suicide. Although the side effects given by these smoking cessations may appear as overwhelming, the results and benefits of becoming or overcoming smoking outweighs the negative and leaves your body with enhanced health and wellness. And these are just my references.